I'm going to discuss on management of vomiting. Why vomiting occurs and what are the causes of vomiting and how to diagnose in this case and also how to manage and what food to avoid in case of vomiting. So we all know that vomiting is a very serious condition that can lead to dehydration, and also if there is severe vomiting that can also lead to hypovolemic shock and can lead to also death. So management of vomiting is very important. When any irritant substance present in the gastrointestinal tract, it can cause vomiting by activating the vagal nerves. The sense goes towards the vomiting center in the medulla, and that can lead to vomiting. And another mechanism is, in case of motion sickness, there is also vestibular cause of vomiting. There is imbalance in the labyrinth, and that can lead to activation of the vomiting center and can cause vomiting. And other conditions like if you are taking some drugs and chemotherapeutic agents, that can also cause vomiting in some patients due to it travels through the vagus nerve to the vomiting center, and vomiting center and chemo receptor trigger zone activated, then vomiting can occur. And also if there are bacterial infection, viral infection, and there are other toxins, and also if there are cancer and neurological manifestations and neurological disorders, hemorrhage in the brain, or different causes are there for vomiting. So to manage vomiting, we have to find out what is the cause, what are the causes of vomiting, and due to what there is vomiting, and there is activation of vomiting center, and that leads to vomiting. So first of all, the diagnosis is very important, whether it is due to bacterial infection, whether it is due to viral infection, or whether it is due to some chemical substance or drugs, or different, whether it is due to food poisoning, whether it is due to gastric ulcer or gastritis, and due to problem in the ear, or due to cardiac cause, any due to heart problem or kidney problem or liver problem or appendicitis, or due to gallstones, or due to pancreatitis, we have to rule out what is the cause of vomiting. And there are lots of drugs that are acting on different receptors and stop the vomiting, like drugs that are acting on 5-HT3 receptors. They are ondansetron, granisetron, palanosetron, and also other drugs that are acting on different receptors, like in case of motion sickness, antihistaminics like promethazine or anticholinergic hyoscine, scopolamine patch, and other drugs. If it is due to a cancer patient is taking some medications, cancer anti-cancer drugs, if it is the vomiting is due to anti-cancer drugs, then the chemotherapy induced nausea and vomiting, we can use aprepitant and fosaprepitant to stop vomiting, and that is NK1 receptor antagonist. And other drugs that are used in case of vomiting, in case of psychological imbalance also there might be chance of nausea and vomiting. In that case we can use prochlorperazine. And in case of vomiting, we have to monitor the blood pressure. If there is, it can also be due to hypertension and also be due to hypotension, or after vomiting it can lead to also hypotension. So if there is hypertension is the cause of vomiting, then antihypertensive drugs to be given. If there is, after vomiting in any patient there is hypotension, blood pressure falls, then in that case you have to manage the dehydration status. You have to provide oral dehydration solution in case of stable patients, and if the patient is severe vomiting, then he or she to be admitted in the hospital and managed, and fluid replacement to be given, and according to the guideline of this hospital the patient to be managed if it is in serious condition. Another cause can also be due to diabetes. There might be diabetes, or in case of diabetic ketoacidosis there might be chance of vomiting. So in that case also we have to manage the diabetes or diabetic ketoacidosis, what may be the cause. So we have to find out what are the different causes of vomiting, and we have to diagnose first whether it is due to cardiac cause. If it is due to heart problem, then if it is due to myocardial infarction, then myocardial infarction to be managed. If it is due to heart failure, then heart failure to be managed. If it is due to kidney failure, then kidney failure to be managed according to guideline. And if it is due to lungs pathology, then that should be managed according to guideline. And also if it is due to liver pathology or pancreatitis or different causes like appendicitis, then that should be managed according to the guideline so that we can stop the vomiting. Otherwise symptomatically we cannot stop vomiting for a long period. So if it is due to gastritis, then pantoprazole and domperidone can be given in empty stomach, Pan-D or combination other brand drugs. And also if it is not stopped by pantoprazole, domperidone, then you can give ondansetron 8 milligram or 4 milligram tablet TDS or as SOS basis for the management of vomiting. But you have to know about the QT prolongation of ondansetron. If there is QT prolonged in the patient, then you should cautiously use ondansetron or some drugs that are causing QT prolongation. And granisetron, pralanosetron are newer drugs you can use for vomiting. And also in case of chemotherapy induced nausea and vomiting, aprepitant, fosaprepitant you can use. And And at last, I want to tell you that you should manage the dehydration first. Otherwise, the patient will land up into serious problems like shock and even death. So, in case of vomiting, the management should be cautiously done in the hospital or by a proper physician or clinician, and you have to avoid some foods. If there is gastritis, you have to avoid some spicy and fatty foods so that it can be avoided, the vomiting can be avoided. And also, if you vomiting is due to stress conditions, then you have to do exercise and lots of yoga exercise for stress management. Or also you have to do some diet control and exercise for that. So in this way you can avoid the vomiting and manage vomiting. And if it is serious or severe case, you have to admitted in the hospital, and you can, and according to the guideline, if treatment occurs, then you will be cured from your vomiting. So yes, someone what it and hello hello, and pyro cheese 72. How do we send? No, it is. I don't think. Okay, I will buy 3. Yes. Okay, if anyone has any question about vomiting, you can ask me so that I can try. I will try my best to answer your questions. Please ask if there is any doubt about vomiting. As vomiting has a complex mechanism, and there is involvement of medulla, vomiting center, and area postrema, and also can be due to chemoreceptor trigger zone. So there are lots of receptors involved in case of vomiting. So according to the receptors, there are lots of drugs there that is acting, that is effective in case of vomiting, that is also marketed in the country. But there might be some medications, drugs that are also in preclinical, clinical trials, and also in phase 0, phase 1, phase 2, phase 3 trials now for the discovery of newer drugs uh, for the management of vomiting. And you can go through different articles published in the journals, reputed journals, so that you can able to know lots about vomiting management and newer drugs that are now going to be available, or there are about the clinical trials of different drugs. And also you can go through guidelines of management of different diseases vomiting that causes vomiting, and in this way you can learn more and more. So there are no one in the, there is no question in the chat box now. So this is for today's session, and I will discuss this vomiting topic in Hindi and Odia also after a few minutes. Please watch my video and subscribe my channel so that you will be able to know lots of things about lots of diseases and the drugs used in those cases, and also on clinical trials of new drugs and drug discovery. So that's all for today. Thank you very much. Thank you very much again. Jai Jagannath.